So yes, hello everyone. So we will start with the session of anatomy recall questions of NEET PG 2021, which was taken on the 11th September. So I will recall all the MCQs related to the anatomy, which I have collected now. So we will discuss that, and we will have a brief discussion of all the MCQs which has been asked in the most recent exam, which has just taken place 3 days before. We will discuss it. Now, my dear students, before starting this session, I would like to tell you that myself, Dr. Monalisa, anatomy faculty on the platform of Unacademy, this is my code ANAT10, which can be used by you if you want to target the free sessions on the Unacademy platform. So actually, this code ANAT10 can not only be used as an unlock code, but can also be used as a referral code if you want to take the plus subscription of Unacademy. So for both the ways, you can use this code. So meanwhile, everyone is joining, I would like to give you a proper introduction about the platform of Unacademy. What is the benefit of special classes? So when you are being the part of special classes on the platform, you will have an interactive. So this is an interactive live session where you can interact with the top educators of Unacademy platform. Polls are conducted among the learners and they can know where they are lying. Raise your hand, have a conversation with the educators, and right itself you get your doubts cleared. Never miss a session. So never miss a session. Whenever you are taking part in the session, what happens, you can follow the educators if you like the sessions taken by the educator, and if you like the session, you can follow them on the Unacademy platform, and thereafter you will get notification regarding all the free sessions and also regarding the plus course. Lecture notes are provided to you, and anytime, anywhere, read from the top educators of Unacademy platform. This is the code which can be used by you as an unlock code to be the part of free sessions on the Unacademy platform. And you can download the PDF notes also once the session is completed. So these are all the benefits of special classes. Now coming to the plus courses. What are the benefits of the plus courses? You can access both the live and the recorded version of the session. So actually you can have a session, all the 19 subject session is taken on the platform of Unacademy. There you can complete the whole session and you can target your dream destination of exam. You can prepare for it in a very systematic way and learn from the top educators in the medical team and examination, compete with live tests and quizzes, and assess yourself where you are lying, what is your weak area, and which of the subject needs more of a revision. Study on your device of choice, assess more than 25,000 MCQs, which is based on the recent pattern of examination, and have a discussion of these sessions. And actually all these MCQs has been made by the top educators of Unacademy platform with a relevant explanation to each and every MCQs. Coming soon is the printed notes will be provided to you. Actually, it is not coming soon. It's already the printed notes of Unacademy is also going to be provided to you if you take the plus subscription. Use this code and add 10 and get 10% discount. So I also want to give you the details of iconic subscription. So if you are going for the iconic subscription, that means you are having both the benefits of two important platforms. One is the plus platform of Unacademy and other is the prep ladder. So you can have the benefit of both the platform. Clinical and integrated sessions is taken. You can target your exam. Video lectures can be assessed by you by the dream team of the prep ladder. QBank 3 can be assessed by you. Rapid revision snapshots and treasures and dream notes, that is of 2021 dream notes of the prep ladder team, will be provided to you. So all these benefits will be very important for you, and you can target these benefits which will be highly beneficial. So this is the important benefits which is in the one platform itself. And again, if you want to take the subscription of iconic subscription, you can use the code ANAT10 and get 10% discount. So my dear students, I am just sharing this slide with you, which is showing you the limited time offer for the NEET PG iconic subscription. So discounted rates, so quite a large discounted rate is offered to you, and again you will get another 10% discount by using the code ANAT10. So like 12 months of subscription, so the discount is more than 10%, is approximately 15 to 20% discount. So just go for it and grab this opportunity and take the subscription. If you are planning to take the subscription of Unacademy and prep ladder, just limited time offer for the NEET PG iconic subscription. The prices are increasing. Pricing will be increased. It's the first 500 students who want to take this subscription, for them the limited time offer is there. So just grab this opportunity and take the subscription of Unacademy if you are planning to take it. Now, I also want to give you the information regarding 25,000 high yield clinical MCQs from all the 19 subject. Detailed explanation is on the platform of Unacademy. Also, I want to give you the information regarding taking 2 years of subscription and getting 4 months of subscription absolutely free. Taking 12 months of subscription and getting 2 months of subscription absolutely free. Just use my code and avail this opportunity and add 10. Okay. And also 1 month package is especially for those students who have already completed their preparation 2 times and they just want a rapid revision. So just go for last 3-year PG questions, COVID test, grand test series, NEET PG analysis test, emergency room MCQs, and ultra fast high revision batches. Also, the batches which is on the platform of Unacademy is Focus FMG batch 2021, started from today itself is 15 September and target next 2022 batch. Use this code for 10% discount. Also, professional 3rd year batch I have started, in which so all the subjects will be completed, but whole of the anatomy will be taken by me. So do join. Also, clinical examination procedure batch is there. Use the code ANAT10 and get 10% discount. NEET PG subscription details of Iconic and Plus is compared. So whichever suits you, just go and grab this opportunity, because the first 500 students will get more than 15% of discount, approximately 15 to 20% of discount. So just grab the opportunity, use my code for additional 10% discount. Okay, students, so let's start with the recall MCQs. All the best. So actually, this will be a session in which I will not conduct the poll. So you can write your messages. All of you, what you can do, you can write your messages. Whichever answer you feel is right, you can write. So this is the discussion of the session of the MCQs recall questions. So whatever I have got regarding this exam, I am sharing it with you. So more inputs you can add on, and again I will take another session where we will have the detailed description of all the questions of NEET PG 2021 anatomy. So inguinal swelling with an hernial sac lying medial to inferior epigastric artery. Where is the hernial sac located? The location of the hernial sac is medial to inferior epigastric artery. So which of the following is the correct pair? So according to you, which combination is right? Whether it is indirect inguinal hernia, Lintison's pair, repair, direct inguinal hernia, Bassani repair, indirect inguinal hernia, and Lichtenstein repair or direct inguinal hernia. So A, B, C, and D. So yes, those who want to give their answers, they can just write in the message box. I'm not conducting the poll. So what you feel, because all the 4 options for every MCQs I have not gathered. So whichever I have gathered, I want to share it with you. So give it the correct answer. What you feel will be the correct answer? Inguinal swelling with, okay, B. Okay. So Anayana is telling it's B. Anayana is telling me. What about others? Indirect inguinal, and the repair is Lichtenstein repair. So these are the names which is given on the surgeons or the person who were first to perform this. So actually the crux point which is mentioned here is medial to inferior epigastric artery. So you have to firstly differentiate what is direct inguinal hernia and what is indirect inguinal hernia. So direct inguinal hernia comes from which space? Anyone? Direct inguinal hernia comes from which space? Any idea? It comes from inguinal triangle or Hazelback triangle. Okay, medial, yes. So why you have written, okay, direct inguinal hernia is absolutely correct, but not the Bassani's repair. Actually, D option is correct. So let me explain you. Actually, D option is correct. Okay, so not the Bassani repair. It's the Lichtenstein repair and direct inguinal hernia. I will explain in brief about this. So see here, this is this PDF also you can download afterwards. So there are 2 types of hernia. One is the direct and other is indirect one. So when we are talking about indirect hernia, it is having the same course as the spermatic cord, and you can just see whenever we talk about indirect hernia, it is passing lateral to inferior epigastric artery. It is passing lateral to inferior epigastric, and the direct one is passing medial to inferior epigastric vessels. Okay, so this is an important difference, and actually The direct one is passing through a weakened area that is called as direct inguinal hernia is passing through inguinal triangle. The other name of inguinal triangle is Hazelback's triangle. And if we talk about indirect inguinal hernia, it is passing through deep inguinal ring. It is traversing through which opening? Deep inguinal ring, and it passes lateral to inferior epigastric vessel. This hernia is passing lateral to inferior epigastric vessels. Now coming to the repair. So let me tell you about the Basini's repair. It is frequently used for indirect inguinal hernias and small direct hernias. Okay. The conjoined tendon and which we know that conjoined tendon is formed by transverse abdominis muscle and that of internal oblique muscle. So these two muscles together is sutured with the inguinal ligament. So this is how it is the repair is taken. Basini's repair is done. So this is how the Basini's repair is done, and we have to go for the not only for Basini's. Actually, the correct answer is we have to go for Lichtenstein technique. This technique is actually tension free and one of the most commonly performed procedure around the world. The first time it was performed for a European Hernial Society of maintaining and approaching towards the treatment of hernia. It is performed for direct inguinal hernia and it is the most commonly used method, and the adhesive glues has been used, and there is faster healing, and also there is less chance of post-operative pain which is occurring in this condition. This Basini's technique was the first efficient technique which has been used for the inguinal hernia repair. But actually, if we have to choose one, we will go for the Lichtenstein's tension-free repair. Okay, so here in Basini's method of treatment, we go for the suturing of conjoined tendon which is formed by transverse abdominis and that of the internal oblique muscle together. So yes, so this was the first question, and here the answer will be D. Got it? Yes. Hello, Rahul. So let's move on to the second one. Let's move. So this was the first MCQ. Whatever MCQs I have targeted and I have got it, I will share it with you. Now, all these will be useful for you. Now coming to the second one, ligament preventing downward displacement of the spleen. कौन सा ligament है जो downward displacement of the spleen को prevent कर रहा है? Any idea? Okay, so any others? So Anana has given her answer. What about others? C is telling B. Okay, C is telling B. Okay, Rahul. So, okay, great. So you are talking about UG or PG? UG or PG, dear? UG. Okay, great. So great. Okay. So let's tell about the correct one. Okay. So this is the discussion of NEET PG question. So yes, the correct answer here will be phrenicocholic ligament. Okay, phrenicocholic ligament is the correct answer. Ligament which is preventing downward displacement of the spleen. The correct answer is phrenicocholic ligament. So my dear students, if you will see here, there is an attachment of phrenicocholic ligament. Can you see here? This is the phrenicocholic ligament which is attached here. Okay, so this is phrenicocholic ligament which is shown in this diagram and which is attached here. Yeah, so it is actually attached. If you will see, it is attaching with the it is passing just below the spleen, and it is preventing the downward displacement of the spleen. Okay, so here a fold of peritoneum that is called as the phrenicocholic ligament is continued from the left cholic flexor, and it get connected to the thoracic diaphragm opposite the 10th and 11th rib. It passes below and serve to support the spleen. What it is doing, it is supporting the spleen, and therefore it is also called as sustentaculum lineis. It is also called as sustentaculum lineis. The phrenicocholic ligament is also called as Hensing's ligament. Hensing's ligament. What is the other name? Hensing's ligament. If we have to choose for one ligament which is supporting and which is giving a pull to that of the spleen, it is not letting the spleen to get downward displaced. The answer will be phrenicocholic ligament. Easy one. We have discussed this before also. Now coming to the next one. A patient with multiple humerus fracture, severe weakness in the flexion and supination of forearm. Okay, so here this is a question from upper limb. So till now what we have seen, the questions which we have listed, this was the question from abdomen, and this is also the question from abdomen. Okay, so first two questions are from the abdomen only. Now moving on with the upper limb question. So a patient with a multiple humeral fracture, severe weakness in the flexion and supination of forearm, and loss of sensation in lateral side of the forearm. Which nerve is commonly injured? Which nerve is commonly injured? Whether it is medial nerve, whether it is ulnar nerve, whether it is musculocutaneous nerve or radial nerve. So anyone wants to give the answer? They can write in the message box whether it is median, ulnar, musculocutaneous or radial nerve. Question number 3. So I will tell you the key point or the crux point which is mentioned here is there is severe weakness in the flexion. There is severe weakness in the flexion and also supination of forearm and loss of sensation on lateral side of forearm. So what would be the correct one? There is loss of sensation in the lateral side of forearm. The key point which is mentioned here is the humerus is fractured and there is loss of sensation on lateral side of forearm. That means the lateral cutaneous nerve of forearm is involved. So lateral cutaneous nerve of forearm is injured, and we know that lateral cutaneous nerve of forearm is a branch of musculocutaneous nerve. Also, the muscles which is supplied by musculocutaneous nerve is biceps brachii, brachialis, and that of coracobrachialis. So it will also affect the supination. So the correct answer will be musculocutaneous nerve. Now see here. So I would like to describe briefly about musculocutaneous nerve injury. The characteristic mechanism of injury includes penetrating trauma to the axilla, stabbing injury, also injury due in the deltopectoral groove of the shoulder as a result of heavy retraction, and the motor function loss, the loss of the function of coracobrachialis, biceps brachii, and brachialis muscles. So these muscles motor function is lost. Coracobrachialis, biceps brachii, and that of brachialis. Now branch of musculocutaneous nerve is lateral cutaneous nerve of forearm. Is the lateral cutaneous nerve of forearm. Actually, the termination of musculocutaneous nerve is by becoming lateral cutaneous nerve of forearm. So this is musculocutaneous nerve. It has formed lateral cutaneous nerve of forearm, which is giving innervation to the lateral aspect of the forearm. So here the nerve is also injured, and the area, as you can see, this is the loss of cutaneous sensation. Loss of cutaneous sensation area is the lateral aspect of forearm which will have the loss of cutaneous sensations, and lesions of musculocutaneous nerve, the flexion of the shoulder and elbow both are weakened. There will be loss of flexion of shoulder and elbow, both are weakened but remain possible as a result of why the full loss of the function of that of supination and that of flexion is not gone, because still pectoralis major and brachioradialis is active. Brachioradialis also enables in supination along with the supinator muscle. So weakness will be there, but full absence of these function will not be there. And also loss of biceps reflex and loss on the lateral aspect of forearm will be present in the patient. So got it? So now coming to question number 4. So question number 4, let's discuss of NEET PG 2021. These are all memory based MCQs of the exam. So one of the question was framed like this: the feeble pulses, the very feeble pulses was present in the femoral artery, and there was increased pressure in the upper limb arteries. There was increased pressure in the upper limb arteries and very feeble pressure in that of the femoral arteries. So prominent intercostal arteries were also seen. So can anybody tell me what will be the cause? Can anybody tell me what would be the cause? It's in the diagram also. The cause will be coarctation of aorta. The cause will be coarctation of aorta. Okay, so actually when the patient will have a presentation, clinical presentation like this, the patient will have coarctation of aorta. Yes, it is one of the so as Turner syndrome was mentioned as an option, Anayana, I haven't got the option, but coarctation of aorta is the correct answer. Yeah. So you can see here why this is the correct answer, because we know that when there is constriction of the aorta, arch of aorta, there is narrowing or coarctation, the normal blood flow of the body is affected. Actually, the backflow of the blood into the left ventricle of the heart make the muscles of left ventricle work more to pump out the blood. Since narrowing of aorta is usually located after the artery and the branches to upper part of the body has been given. So normally there will be normal blood pressure, yeah, high blood pressure in the upper limb, head and arms, but we will see weak blood pressures in the lower limb or the legs. This is the clinical features which is seen in the patient. These are the clinical features which is seen in the patient of coarctation of aorta. Also, what is actually posterior intercostal arteries will become more collateral circulation is formed, and this will give on radiological imaging. Can you see there is slight notching? So can you see there is slight notching of the lower ribs? Okay, so there will be notching in when the radiological examination of ribs is done. Notching of the rib or rib notching is a radiological sign which is seen in the long lasting cases of coarctation of aorta when collateral circulation is also formed. Inferior rib notching is associated with coarctation of aorta as a result of dilatation of intercostal arteries. What is the reason? The result will be dilatation of intercostal arteries. Got everyone? So let's discuss the fifth MCQ. So one of the question was like this, an image was shown and you have to identify the papilla. Anyone wants to give the answer? Which papilla is it? Identify the papillae. So actually this is one of the tongue papilla, and the correct answer is it is circumvallate. It's the circumvallate papillae. Is the circumvallate papilla. Okay, so what you can see, a broad upper aspect, and you can see there is a mort on either side. Okay, what you will see, there is a mort on either side. So depression or mort is seen on the either side. There is depressed or mort is seen on the either side. Can you see here? On either side of circumvallate papilla, there is a mort which is seen. Okay, and also here, what you can appreciate here, these are all taste buds. What are these? These are gustatory taste buds which is lying in the lateral margin of the circumvallate papilla. Okay, so in the histology session I have shown this diagram, and we can clearly see which papilla is this. The correct answer will be circumvallate papillae. The correct answer will be circumvallate papillae. Got it, everyone? Now moving on to the next one. Last ligament to be punctured during the process of lumbar puncture. Last ligament to be punctured during the process of lumbar puncture. So the options are dura mater, arachnoid mater, ligamentum flavum, and pia mater. So last ligament to be punctured. Which of the following is the last ligament to be punctured? Whether it is dura mater, whether it is arachnoid mater, whether it is ligamentum flavum, or whether it is pia mater. Four options are there. Last ligament to be punctured during lumbar puncture. Four options are there. So here actually in this option, in this question, clearly they have mentioned the ligament to be punctured last. And we know that lumbar puncture is done. Dura mater, Anayana, dura mater. No dear, dura mater nahi hai. Correct answer, arachnoid mater hoga. Okay. Yes. If why? Because if the loss of resistance is felt or popping sound is felt, then we will go with the dura mater. This is a question from the back region. Okay, and the previous one was from the histology part. Okay, now dear students, so what happens actually, last structure agar question mein last structure punctured hai, then the correct answer is lumbar puncture only. Then the correct answer of lumbar puncture, the arachnoid mater, because which space has to be approached? कौन से space में reach करना है? Sub arachnoid space. कौन से space में reach करना है? Sub arachnoid space में reach करना है. Sub arachnoid space पे reach करना है. So we have to reach the subarachnoid space to drain the CSF, and normally the puncture is formed on L4, L5 or L3, L4 space. And we know that L1 level पे हमारा spinal cord end होता है, तो lower to it the lumbar puncture has to be performed for diagnostic or therapeutic cases. So arachnoid mater is the layer which will be large puncture, so we can approach to subarachnoid space where the CSF lies and drain the CSF. If the popping sound is heard, then we can go for dura mater and ligamentum flavum. Dura mater, ligamentum flavum. So abhi kaun sa answer hoga? Arachnoid matter. So I will also show you the structure. So now, is it okay, Anayana? So see here, the structures being pierced is skin, subcutaneous layer, back muscle, erector spiny group muscle, supraspinatus ligament, interspinous, ligamentum flavum, and then is the epidural space reached. But we have to not reach the epidural space, we have to reach the subarachnoid space. So then the dura mater and arachnoid mater is pierced. So sequentially, the structures pierced is shown in this diagram. So very nicely, all the sequence of the structure being pierced is shown in this diagram. Okay. So see here, the first structure is skin. The second structure is subcutaneous tissue. Few back muscles, supraspinatus ligament, interspinous, ligamentum flavum. Then we reach the epidural space. And then we have to puncture the dura mater arachnoid, and then the subarachnoid space is reached. So we have to go as arachnoid matter as the correct answer in this question. Now moving on to the next. Patient was presented with a swelling and tumor of submandibular gland. Patient was presented with swelling and tumor of submandibular gland. Submandibular gland and ducts were removed. So which of the following nerve was injured? Which of the following nerve is injured? So the key point which is performed, anyone wants to give the answer, they can write in this message box. So those who want to give the answer, they can write the answers in their message box. Okay, whichever you feel is the correct answer. Lingual. So we see Shweta. Shweta, absolutely right. You are lingual nerve is the correct answer. Actually, when you will see the diagram of the submandibular gland and when you will see the relations over the hyoglossus muscle, clearly we have seen the lingual nerve winding around submandibular duct. So in the removal of submandibular gland and the duct, there is chance that the lingual nerve is injured. Hypoglossal nerve will be lying lower down. So we have to choose one as the answer. We will go with B as the lingual nerve. So this diagram will clear your answer. So this is the lingual nerve, and you can see here lingual nerve is winding around a duct. So everyone, can you see this is the duct? Which duct? Submandibular duct. Okay, this is the submandibular duct and the nerve which is winding. So you can clearly see the lingual nerve here is seen winding around from lateral and then moving on to the medial aspect of this duct. So lingual nerve will be injured when any kind of tumor, any kind of swelling is there and we want to remove the gland or the duct. So lingual nerve come jada chance hai. Hypoglossal nerve, see here, lower down, it is running over hyoglossus muscle. So which nerve is most commonly injured? Lingual nerve. Opening of the submandibular duct is also shown in the sublingual papillae. So yes, let's move on to the next MCQ, that is question number 8. Total thyroidectomy was done and the patient presented with breathing difficulty and respiratory distress. So what causes the condition? Total thyroidectomy was done and the patient presented with breathing difficulty and respiratory distress. So what is the cause of this condition? Whether it is hemorrhage, bilateral recurrent laryngeal nerve injury, unilateral recurrent laryngeal nerve injury, or superior laryngeal nerve injury. Question number 8, what do you feel is the correct answer? Total thyroidectomy was done. The patient presented with breathing difficulty and respiratory distress. What is the cause of such condition? Unilateral recurrent laryngeal nerve injury. Why unilateral? The patient is suffocating, breathing difficulty and respiratory distress. See, the question is telling you about the important sign and symptoms in the patient is that he or she is having breathing difficulty and respiratory distress. So that is only seen when there is both recurrent laryngeal nerve injury. जब both the recurrent laryngeal nerve injury होता है, उस case में we can see this condition. So when the total thyroidectomy is done, the patient will have the breathing difficulties, respiratory distress. So bilateral recurrent laryngeal nerve injury is the correct answer. One more thing is important for this answer, that in case of thyroid removal, the two arteries are there and two nerves are winding around this artery. So see the relation. In this diagram, you can see this is the superior thyroid artery, and close to superior thyroid artery, external laryngeal nerve lies. External laryngeal nerve will be injured if the superior thyroid artery is injured. And if external laryngeal nerve is injured, the muscle which is injured is cricothyroid muscle. My dear students, now when the inferior thyroid artery is injured, the nerve which is lying in close association with inferior thyroid artery is recurrent laryngeal nerve, and it will injure all the muscles of larynx. It will injure all the muscles or intrinsic muscles of larynx. It will lead to injury of all the intrinsic muscles of the larynx. And when the intrinsic muscles of larynx is injured, the posterior cricoarytenoid muscle will be also injured. Actually, the posterior cricoarytenoid muscle, when we are talking about posterior cricoarytenoid muscle, it is the muscle which is causing abduction of the larynx. It is the muscle which is causing abduction of larynx. Okay, they are abductors of the larynx. So there is no abduction. So the larynx intrinsic muscle will be in the position of adducted stage. Means there is no space for the air to bypass and all. So it will lead to the constriction. Okay, the midline में सारे muscles आ जाएंगे because abduction is not possible, and this will lead to breathing difficulty and respiratory distress. This is an emergency condition, and this is seen in the case of bilateral recurrent nerve injury. All the muscle, intrinsic muscles of larynx is supplied by recurrent laryngeal nerve except cricothyroid. But cricothyroid का action tensioning of larynx है. अगर abduction of larynx की बात करेंगे तो कौन सा muscle है? Posterior cricoarytenoid muscle. Yes, yes, Anaya. A cricothyroid is only supplied by external laryngeal nerve. Now, one of the questions was like this: the patient was presented with a swelling. So this was the history which was provided in the question in the 11th September examination, NEET PG 2021. The whole option I didn't find till now. So the patient presented with swelling in the lower abdomen with the difficulty in hip flexion and adduction. So what is the reason for this cause? So actually, an image like this was provided, and you have to know which structure was involved. So actually, यहाँ पे अगर ये arrow marked है, तो this is the area of psoas abscess. The correct answer is psoas abscess. Actually, psoas abscess, psoas muscle is psoas major muscle is originating from the lumbar region, and from here it is inserting into the lesser trochanter of the femur. Okay, so lumbar region से origin करके वो कहाँ insert हो रहा है? Lesser trochanter of the femur. And actually, very commonly we know that lumbar vertebrae are involved in cases of tuberculosis. So there will be involvement of tuberculosis के कारण lumbar vertebrae involved होगा. Transmission of infection can reach from the abdomen region, and this can lead to the formation of abscess which can go till the level of lower limb or groin region. It will go in which region? Groin region. It will reach the groin region. Okay, so psoas abscess, the focus of pus can be in the case of intervertebral disc lumbar vertebra and can track down and present as a lump. It will be presenting as a lump in the groin region. Tuberculosis of the spine is a very common in the lumbar vertebrae, and it will lead to the formation of psoas abscess as shown in the diagram. So this is the abscess which is formed here, and here is the psoas abscess which formed, will drain into the groin region as across the psoas muscle to be going towards the lesser trochanter region. So this is a whole detail of the psoas major muscle. Origin from the transverse process of lumbar vertebrae, T12 also contribution to TL4, lateral aspect intervertebral disc, insertion into the lesser trochanter of femur, lumbar artery, branch of iliolumbar artery is giving the arterial supply, nerve supply is by when the branches L1, L2, L3, and the action of the muscle affected is that of flexion of hip joint, flexion of hip joint. So got it, psoas abscess. Now let's move on to the next one, that is question number 10th. A patient diagnosed with a multiple sclerosis. So which cells are involved? What is the answer? Those who feel and those who want to give the answer, they can write their answers accordingly. So a patient is diagnosed with multiple sclerosis. Which cells are commonly involved? Which cells are commonly involved? Ependymal cells, oligodendrocytes, microglia, or astrocytes? Ependymal cells, oligodendrocytes. Yes, Shweta, absolutely right. Actually, there is two types of cells. One is Schwann cells, which is providing myelin sheath. So here, multiple sclerosis, we all know that it is demyelinating disorder, most commonly demyelinating disorder. So myelin sheath ka deficiency hoga, and we know that myelin sheath is formed by oligodendrocytes in case of central nervous system, and in case of peripheral nervous system, myelin sheath is formed by Schwann cells. It is formed by Schwann cells. So oligodendrocyte is the right answer. Multiple sclerosis, most common demyelinating disease of central nervous system. As we know, Schwann cells will be forming myelin sheath in peripheral nervous system, and oligodendrocyte is the A glial cells which is providing the myelin sheath in central nervous system. Oligodendrocyte is important function is the maintenance and generation and forming myelin sheath around the axons. All other options are not correct. Ependyma mainly the ventricles को line करता है, CSF drain करता है. Microglial cells, astrocytes are not the correct answer. Microglial cells is behaving like macrophages. Astrocytes are forming blood-brain barrier. Blood-brain barrier. So see here. Here is a diagram of blood-brain barrier. Blood-brain barrier, where you can see astrocytes is forming the component of blood-brain barrier along with the basal lamina and pericyte cells of the capillaries. And microglial cells are special kind of cells, which is we know that astrocytes is taking part in formation of blood-brain barrier, and microglial cells, as I told you, it is behaving as a macrophages. Removal of also neurons and infections are important features for the microglial cells. Now, which artery carries? So this is a direct question from embryology, easy one. Which artery carries deoxygenated blood from the embryo to the placenta? Anyone? This is a direct question, straightforward question. The correct answer is umbilical artery. So umbilical vein is for oxygenated blood, deoxygenated blood ke liye umbilical artery is the correct answer. So umbilical vein carries oxygenated blood, that is nutrient-rich blood from the placenta to the fetus. Umbilical vein carries oxygenated blood, nutrient-rich blood from the placenta to the fetus, and umbilical arteries carries deoxygenated blood, nutrients-depleted blood from the fetus to the placenta. Okay. Now, one of the question was patient presented. So what happens? Patient presented in the swallowing. Physician noticed the following thing. Physician noticed the following. So you have to just tell me which is the correct answer, which nerve. So actually, the area which was involved here. Okay, just let me. Okay, so exactly the arrow mark structure was involved in the diagram. So here I would like to show you the arrow mark. Uvula. Kya involved kiya tha? Uvula. Okay, so uvula part of soft palate. So that was touch, and which was the nerve? Actually, 11th and 12th nerve is not motor. What is the patient presented difficulty in swallowing? And motor innervation will be affected, not the sensory part. Spinal accessory nerve is involved for motor innervation to trapezius and sternocleidomastoid. So ये correct answer नहीं होगा. This would not be the right answer. Hypoglossal, no doubt, because it is not supplying tongue muscle. So यहाँ पे either 9 या 10 correct answer होता है. Actually, what is being performed? Gag reflex. And we know the gag reflex में both 9 and 10 nerves are involved. But if we have to choose for motor component, we will choose the 10th one. So better answer is vagus nerve is the correct answer. So here you can see this is the part of soft palate, and this is a diagram showing sagittal section of head and neck. This is the part of soft palate, as you can see here, and it is just connected to the posterior aspect of hard palate, and it is just protruding down. And this is touch for the gag reflex. So clinical relevance of gag reflex is glossopharyngeal nerve is for sensory component or afferent component, which is sensory component of innervation of oropharynx carrying afferent information for gag reflex. Now, so only 9th cranial nerve is not the correct answer. We will go for the 10th one. Sensory limb is mediated by glossopharyngeal nerve. Motor limb is mediated by vagus nerve. Gag reflex is involved in brisk and brief elevation of soft palate and bilateral contraction of pharyngeal muscle, which is evoked by touching the posterior pharyngeal wall. By touching the posterior pharyngeal wall. So here What will be the clinical relevance of gag reflex? When a foreign object touches the back of the mouth, it stimulates the ninth cranial nerve, beginning of this reflex, and the efferent component of this nerve or the motor component of gag reflex is which nerve? Vagus nerve. So only we have choose the correct answer as 10th cranial nerve. So the correct answer will be 10th cranial nerve. Here the correct answer will be 10. Now let's move on to the next one. These are all memory-based MCQs for the NEET PG 2021. Patient is having visual disturbance and on examination a vessel developed aneurysm. A vessel developed aneurysm at the base of the brain. So at the base of the brain, aneurysm is seen compressing the optic chiasma. Which structure is compressed? Optic chiasma is compressed. So which of the following structure is involved? Which of the following structure is involved? Whether it is anterior cerebral artery, anterior communicating artery, anterior choroidal artery, posterior cerebral artery. So according to you, which is the correct answer? The key point which is mentioned is optic chiasma. Close to optic chiasma, an aneurysm is formed, and this will lead to visual disturbance. The correct answer is anterior communicating artery. I will show you a diagram for it, which will make you clear. So see here, what you can see, this region is optic chiasma. Okay, this is the optic chiasma region. Okay, this is the optic chiasma. And just anterior to optic chiasma lies anterior cerebral artery. Two sides anterior cerebral artery is connected by this connecting link. Okay, so two sides anterior cerebral artery is connected by this artery that is called anterior communicating artery. So this is anterior communicating artery. So close to optic chiasma, which structure will be the most correct and affected? Actually, also the reason of hemorrhage of the berry aneurysm, the most common arteries to be affected is anterior communicating artery. And in this diagram, we can see that anterior communicating artery is lying very close or just anterior to that of optic chiasma. So in case of optic chiasma, the artery or aneurysm or the bleeding or hemorrhage can be from anterior communicating artery. So we have to choose one. So here the correct answer will be, on examination of vessel developed aneurysm at the base of the brain compressing optic chiasma. So here we have to choose, the correct answer will be anterior communicating artery forming a connection between anterior cerebral arteries of both the side. Now question number 14. Great saphenous vein was used as a graft for coronary bypass surgery. Great saphenous vein was used as a graft for coronary bypass surgery, after which the patient developed loss of sensation on anterior medial leg and medial foot. The loss of sensation on anterior medial leg and medial foot. So which of the following nerve is injured? Sural nerve or saphenous nerve? Question number 14. Sural nerve or saphenous nerve? Which of the following nerve is affected? Sural or saphenous nerve? Now the correct answer for this question will be saphenous nerve. Actually, we have got great saphenous vein on medial side. We have got short saphenous vein on lateral side. Close to great saphenous vein, the nerve which is closely related is the saphenous nerve, and sural nerve is lying in close relation to short saphenous vein on lateral side. So the key point which is mentioned is affection of anterior and medial side of the leg and medial aspect of the foot. So great saphenous vein run along with the saphenous nerve, which is a branch of femoral nerve, cutaneous nerve, and this would be the correct answer. See here. If we will see the saphenous nerve innervation, saphenous nerve. Okay, so medial. So this is the great toe, GT for great toe. So this is the medial aspect of the leg, slightly anterior aspect, anteromedially. Whole is getting innervation from the saphenous nerve. And lateral side is by the sural nerve. Lateral side with the sural nerve. Okay, so let me tell you. Let me show you. This is great saphenous vein. And very close to great saphenous vein, the nerve which is running is the saphenous nerve. So this is on the medial side. So this will be the chance of getting injured if great saphenous vein is injured. Same way, when you will see the, let me slightly zoom out. So you can see small saphenous vein is running on the lateral side, and it is lying very close to which nerve? Sural nerve, which is a branch, which is having, sural nerve is having a medial and lateral component from the from the tibial and common peroneal nerve. So sural nerve is running close to short saphenous vein, and that of great saphenous vein is running close to saphenous nerve. Now, also moving on to the next, one other question which was asked, one of the image was given and you have to identify the test being performed. Okay, so here the hand is kept flat on the table and which test is performed. So actually the test which is performed is pen test, and for which nerve it is performed? The answer is median nerve. It is testing the integrity of which muscle? Abductor pollicis. Okay, the integrity of abductor pollicis is done. Abductor pollicis brevis is getting innervation from median nerve. So abductor pollicis brevis muscle integrity can be tested by a test being performed. The name of that test is pen test. Okay, so abductor pollicis brevis, abduction of thumb is done. The pen is kept at a level slightly higher to that of, as same as the diagram which is shown here, slightly at a higher level, and then the thumb, and the patient is asked to touch the tip of the pen, and this process involves abduction of thumb. So this can be done when the median nerve is not injured and the integrity of abductor pollicis brevis muscle nerve supply is maintained. So abductor pollicis brevis is the correct answer. Now, my dear students, before ending the session, I would like to tell the students that 7 p.m. also I am taking another session, free session today, that is the topic of joints. So those who are interested, they can join me for the 7 p.m. session. Use the unlock code, download the Unacademy app and use the unlock code NAT10 for taking the subscription of Unacademy, or for also unlocking the free sessions. I also want to tell you about the free special offers where you can use my code NAT10 as a referral code, and these are the discounted rate. Can you see? These are the discounted rate and the offer of NEET PG iconic subscription, which will be for first 500 students. So just go and grab it. If you are thinking of taking the subscription of Prep Ladder and the Unacademy as a merge, that is called as NEET PG iconic subscription, just go and grab the opportunity of taking the subscription. Either for 1 year or 4 years, you will get a high discount rate, more than 15%, near about 15-20%. So just use my code and get additional 10% discount. So just grab the opportunity, because the time, it is time limited. First 500 students will get this opportunity. Other than that, I also want to tell you, boost your preparation of your medical entrance exam by taking 2 years of subscription and getting 4 months of subscription absolutely free. Boost your preparation by taking 1 year of subscription and getting additional 2 months of subscription absolutely free. So this opportunity can be again grabbed by you by using my code NAT10, and additional 10% discount. Okay, additional 10% discount will be given to you. Also, I want to tell you that few of the sessions which is starting on the platform of Unacademy, one of the session is clinical examination procedures and the other session is professional third year batch. So those who are interested, they can take the plus subscription, use my code for 10% discount. This will be highly beneficial for you. And before ending the session, I would also like to tell you about my free sessions. So timing and all, let me tell. So those students who have joined late, all the memory-based questions of the NEET PG 2021 I have discussed. So you can just revise and go through this session. This will be highly beneficial for you. And those students who want to join me for the free special class on the Unacademy platform, they can just use my code NAT10. And now from the 7 p.m. session, I am taking the topic of joints. Okay. So I am taking general anatomy topic, that is joints, which will be useful for you. So join me for the joint topic, and this will start exactly at 7 p.m. The students who are seeing the session for the first time, they have to download the Unacademy app, use the code NAT10, and then they will be able to see the session. They can also download the PDF once the session is completed. And these are the session details, which is the discounted rate of the limited time offer for NEET PG iconic subscription. Interested student can access both the best learning platform for the medical entrance examination, NEET PG and next examination. Go for the subscription. First 500 students will get more than 15 to 20% discount. Use the code NAT10 for additional discount. All the best. Keep studying. Thank you so much. So again, 7 p.m. session, interested students can join for my free special session on the topic of joints. Thank you.